Well, hello again. It's Dr. Anthony Davis at the Davis Medical Group in East Texas. Today's topic will be vitamin B12. Your body needs it. You can't live without it. It's so important. If you like this video and all my videos, please give me a like down below. Please give me a like, a thumbs up, comment any questions you might have, if they're good. And be sure and subscribe. Subscribe, that helps me a lot. That helps grow the channel. It helps more people to get this information. It's so important to hear this and understand it, and it helps you and your provider take better care of yourself. I've heard it said that B12 affects over 400 different body functions. It may be more than that, I don't know, but it affects some very, very important ones. Brain function, nerve function. Literally, if you've watched my dementia video, if you haven't, please go watch it. Literally, B12 can give you dementia. It can give you reversible metabolic dementia. So it's a pretty big deal. And we live in a world where we have a lot of diseases that we take medicines for, like diabetes and heartburn and reflux. And all of those different things and all of those different medicines are notorious for lowering your B12 levels. So imagine taking something for your diabetes that gives you dementia because it makes your B12 level go down. And there are some genetic issues. There's a particular one called MTHFR, methotetrahydrofolate reductase deficiency. A good third of the population lacks the ability to methylate B12 and folic acid. I've always explained this. Your body doesn't know what B12 looks like. It's a stranger. It won't absorb B12. It doesn't know it. Unless it's wearing a little red beret. And if it's got that little red beret on, your body goes, oh, I know you. Come on in. That little red beret is a methyl group. So most people have an enzyme in their stomach that converts or methylates or puts the little beret on the B12 and folic acid, and your body then just absorbs it. Well, you may be one of the 1/3 of the population that just can't, and you never will. Therefore, your B12 and folic acid must be methylated before you take it. And that's the difference between methyl B12 and methyl folic acid and regular old B12 and folic acid. And there's a lot of people who lack intrinsic factor. Intrinsic factor is made by some of the cells in your stomach called parietal cells. Parietal cells make intrinsic factor, which is kind of in the same genre. It allows your body to assimilate and absorb the B12. And there's autoimmune diseases out there, one of them called pernicious anemia, where it destroys those parietal cells and you just can't absorb it. And so getting B12 and folic acid in your body is a big deal. And then there's this big push. Not a big fan, but I'm part of this world of eating meatless meals or no meat. Put it this way, if you're a vegan or a vegetarian, you must supplement B12. I'm kind of a logical guy. If I'm choosing to eat food that causes me to be deficient in something, but yet if I ate a different food, it wouldn't be deficient in it, maybe I was designed to eat that food that gives me the B12. I think there's a lot of misinformation out there. If you want B12, it comes from certain foods. So here's a list of foods and sources of B12. So I don't want to step on any toes, but the only way you get B12 is from eating animals. So if humans must have B12 to live, if you must have it for your body to function, and the only way to get it is through animal foods, particularly liver and muscle meats and fish and eggs and dairy, I pretty much think that defines what your essential diet should include. So either your essential diet is being a vegetarian or a vegan, no offense, and then taking vitamin B12 supplements so that you can get the nutrients that you should have gotten from the food that you were eating, or it means that it should include meat, liver, meat, muscle, fish, eggs, dairy. It's self-evident that you need B12 and you must have it or you get serious diseases. And so if you're not going to eat B12 for whatever reasons, moral, ethical, religious, whatever, then you better take it because your body needs it. It doesn't just need it, it must have it for you to function. So the following symptoms will occur if you have a B12 deficiency. All right, so here we go again. Us physicians are famous for our mnemonics. A mnemonic is this particular mnemonic is the 5 P's of B12 deficiency. The first one is pancytopenia. So let's define that. Pancytopenia means all of your blood cells are low. White, red, platelets, they're all low. The bone marrow needs the B12 to be told what to do. It can't function. It won't produce red blood cells, white blood cells, or platelets without B12 direction. So there's P1, pancytopenia. Number 2 is peripheral neuropathy. That makes sense, right? This is your periphery. This is your center. So peripheral neuropathy means you lose sensation in your fingers and toes. You have that burning, numbing, painful sensation in your fingers and toes. Often that's a B12 deficiency. So that's number 2, pancytopenia, peripheral neuropathy. Number 3 gets a little bit, I got to say the words first, papillary atrophy of the tongue. Pretty gross if I just stuck my tongue out. So I'm going to put a picture of papillary atrophy right here. That's a sign of B12 deficiency. Yeah. So it's important to know that that's what that looks like. And so that's part of the deal. So there's your third one, pancytopenia, peripheral neuropathy, papillary atrophy of the tongue. The next one, posterior spinal cord neuropathy. What does that look like? You can't touch, feel, or sense things at the spinal cord level. You stop feeling things. You have difficulty moving your arms and legs. You have ataxia. Ataxia, inability to walk properly or move properly or perform functions properly, and your reflexes go away. Now, so if normally you tap a reflex and you get a, if you tap it in the right spot, you get that reflex, right? If you have B12, you can't hit it hard enough, you can't hit the knee hard enough, there just won't be reflexes. And sadly, if you get that and you have a severe enough B12, half the time they won't ever come back. You'll have areflexia, no reflexes forever. Though that's the 4th P. The 5th P, pyramidal tract signs. What does that look like? Paraplegia, paralysis, spasticity. You can't move your arms or legs, and even bladder incontinence. So just think of people who may have had these things, and for all these years, it could be a B12 deficiency. Or think of somebody presenting into the emergency room with paraplegia, and your first thought is not going to be B12 deficiency. But what if they're a vegetarian or a vegan? Okay, so it's important to know that B12 is not tiny or weak. It's when you hear the word vitamins, sometimes you think, it can't be that serious. I'll forget to take it. Maybe I'll miss some of my doses. Maybe I'll just, who knows. If you have a B12 issue, it's extremely important that you take your B12. All right, so this is pretty technical, so forgive me if I read some of it. I think that the symptoms can be the whole body, head to toe, skin, nail, hairs, brain, eyes, mouth, tongue, heart, lungs, kidney, all of it. So we're going to start with the neurologic symptoms of B12 deficiency. I almost said dementia because I was thinking about it. So you get cognitive impairment, which is just 2 + 2 is 4. It takes a little while. You get cognitive impairment all the way up to full-blown dementia. Remember we talked about dementia? If you haven't watched that video, please go watch the dementia video. You'll see what I'm talking about. Metabolic dementia can be caused by B12 deficiency. Progressive demyelination. All right, so the nerves are just like copper wires. They have to have a sheath on them. So picture a wire in your brain that you get at the store. It has a red, a black, or a blue coating on it. That's myelin. That keeps the electrical impulses inside the nerve so they can shoot up and down the nerve without jumping off and short-circuiting. So you get a progressive demyelination because of B12 deficiency. There's a lot of diseases that look like that, right? Multiple sclerosis. Anyway, I don't want to go through the list, but you lose the sheath over the nerve, and that gives you all kinds of stuff. You have trouble walking, moving your feet. You have trouble with your reflexes. You get peripheral neuropathy, you get weakness, your eyes stop working, your nerve around your eyes loses its sheath and your vision deteriorates. You can't smell, you can't see. Think about a nerve, it stops working. And you get these problems with your reflexes, and all of those, particularly the reflexes, could be permanent. All right, moving on. So we did the neurologic symptoms. Guess what happens to your skin and hair if you have a B12 deficiency, or could happen, obviously. You lose your pigment in your hair. I'm not sure that's a B12 deficiency because I'm taking them. That might just be birthday disease. But you lose pigmentation in your hair. It can be at any age and at any volume of hair color in your hair loss. You can get vitiligo. You've seen people with vitiligo, that can be, it's not always a B12 deficiency, but certainly B12 deficiency can cause that. You can just be generally pale. Pallor, it's called. Pale skin can be a B12 deficiency. Certainly an unhealthy appearance of the skin. And you can even get hyperpigmentation in certain areas. Classically, you'd see it in these creases in your palm. They'd be very dark. The same thing in your elbow, in this crease here. You can get, your flexor surfaces here can get dark, and so you can see some hyperpigmentation in your skin from B12 deficiency. All right, we talked about your neurologic system and your integumentary system, your skin. Let's talk about your gastrointestinal system, your GI system, your stomach system. So what happens there? lots of weird things can happen from B12 deficiency. You can get jaundice. You can get full-blown jaundice, turn yellow, just like if you had a liver failure. You can have anorexia. Anorexia is a classic term for just not wanting to eat, having no appetite. You can get the tongue issues we talked about earlier in the 5 Ps. You can lose the papillaries, the taste buds of the tongue. That ruins your ability to taste, and you can get angular cheilitis. Have you ever had or seen somebody with kind of cracking right here in a disease state of their angles of their mouth? That certainly could be a B12 deficiency. Certainly many B vitamins, riboflavin included, which is B2, can cause angular cheilitis, which is that cracking of the skin right there. But B12, that's one of the many things it can cause. So neurologic, GI, skin, psychiatric, psychosis. B12 deficiency can make you act abnormal and see and do things that you would never do. It can also cause a significant worsening in major depression. And so major depression with psychosis also by itself. And so psychiatric symptoms can certainly be B12. They not always, so don't just assume that it's B12, but don't ignore B12 either. It's very important to think about B12 when those symptoms occur. You know, a fascinating thing about B12 is that it's stored in your liver. That's where you keep your B12 stores, in your liver. And I already told you where B12 comes from. It comes from eating meat, animal meat, liver, eggs, fish, dairy. And you can store up to 10 years worth of B12 in your liver. So if you've been a vegan or a vegetarian for a couple years and you're feeling good and you don't have any of these symptoms and you're like, I don't believe you, be very wary. At 5 years or even up to 10 years, your symptoms of B12 deficiency could come on dramatically because your livers can store a bunch of B12. So it's important to know that just because you feel good now, let's say you've adopted a vegetarian or a vegan lifestyle and you refuse to take B12 for whatever reason, which makes no sense to me, it could sneak up on you. So always keep an eye out. Or if you know somebody who's been a vegetarian or a vegan for 5 to 10 years and they have these symptoms, it's because they had reserves for a while and then they used them up. So it's important to know that B12 deficiency can come on years, even up to a decade after you stop ingesting B12. So you come into the clinic and we check your B12 level. What should it be? What should it be? Well, it should definitely not be below 150. That's a problem. And you're going to very likely have these symptoms. If I see it down in the 300-400s, I get a little bit nervous. So basically I want it to be above 400. That's where I'm going to try to get you. Really, I don't care if it's anywhere above from 400 to 1,000, I'll be happy. And so if you're in that 150 to 400 range, some people might argue that you don't want to take, you don't have to take something, but I think you should. I think you should always consider taking something if it's below 400. And if it's above 400, I think you're good. So that's really all there is to it. You take your B12 level, and if you're below 400, you take some. And if you're in the high-risk group, and dietary-wise, that's elderly, people that don't eat enough, and vegans and vegetarians, you should definitely be taking B12. There's nothing wrong with being any one of those things, but you should supplement. So another very important group of people is people that are on medications. There are plenty of medications, and some that you take all the time that have a tendency to kill your B12. What are they? Well, I would say that the number one is metformin. Go back and watch my videos. Every single person seems to have a sugar problem because they refuse to stop abusing sugar. And so every single person who has a sugar problem that gets put on a prescription drug gets put on metformin. Metformin notoriously crashes and burns your B12 level. And so if you are on metformin, you must take B12, or at least monitor your levels very closely. Because you can imagine taking something for diabetes, metformin, and next thing you know, you got dementia. Or you've got apraxia or ataxia, you've got difficulty speaking, talking, you've got difficulties feeling things. Goodness sakes, one of the biggest things that happens to a diabetic is peripheral neuropathy because the nerves die. And maybe your B12 level takes a humongous hit. So the next one is stomach medicine, any stomach medicine, whether it's a H2 blocker like Pepcid or Zantac, I think Zantac's gone, Pepcid or ranitidine, any of those H2 blockers or the proton pump inhibitors like Prilosec and Nexium, and those guys are all good medicines, but what do? They kill your ability to absorb vitamin B12, and those are taken all the time. So metformin and antacids are the big boys, but there are plenty of others. Antibiotics but I don't think you're on antibiotics unless you're forced to take antibiotics on a day-to-day basis, particularly the sulfa antibiotics. You're not really going to get that problem, but if you're forced to take antibiotics on a daily basis, you need to take B12 on a daily basis. Seizure medicines are famous for this. Dilantin, valproic acid, which is Depakote. phenobarbital, primidone. Those medicines can certainly lower your B12 level. Here's a big boy. Birth control pills. Birth control pills can significantly lower your B12 level. So it's important, if you take a birth control, you should be taking a B12 replacement. Alcohol, certainly, if you're an alcohol abuser, here's another time where alcohol abuse, just like with triglycerides, alcohol abuse is going to significantly drop your B12. One of the things that we give people with alcoholism in the ER is a big bag of fluids. What's in it? B vitamins, B vitamins. And if you're taking methotrexate for whatever reason, whether it's a rheumatoid arthritis or some kind of autoimmune disease, skin issue, you need to take B12. So you should go to your doctor or your provider and you should have your B12 level checked, period, no matter who you are. If you are in the high-risk group, people that don't eat enough, elderly, vegetarians, vegans, you should really be supplementing. If you're a breastfeeding vegan mother and that baby is primarily breastfed, you have not given that baby any B12. If you have switched over to a vegetarian or a vegan lifestyle and it's been less than 5 years, you need to keep your head up and you need to have your B12 level checked regularly. You could run out all of a sudden after 5 years, after 7 years. You could just crash and burn and all of these symptoms could show up. And of course, everyone's going to not think about B12 because you're so healthy, right? You're eating nothing but vegetables. But your B12 level could crash and burn. I would think that keeping you healthy and making sure that you don't have a B12 deficiency would be on everyone's agenda. So please get it checked. If you like this video, give me a thumbs up. I'll try my best. I'll really, this is just for my patients and an adjunct, but obviously I want more and more people to know these things. I want you to know the basics. I think that please subscribe to this channel. That way you can and click the notifications and it'll ding you when I put up a new one. I think this is all good knowledge to have. So have a great day. Dr. Davis, East Texas. Bye.